Our trip to Yenche in Kuje Area Council began at about 11:30 a.m. and ended at about 2:30 p.m. The journey was an adventurous one as we had to battle with the very bad road. Avoiding the road made it necessary for us to drive through a thick bush where we had to struggle the right of way with cows before gaining access to get to where Yenche's primary health care is situated. This is the only surviving healthcare center in Yenche community. Before the construction of this healthcare center, many lives were lost as a result of having to travel very far distances to get medical attention. Today, the people of Yenche have the center at their doorstep. This has made it easier for people like Madam Titi, who has been admitted for diarrhea and vomiting. 65-year-old Madam Titi could not talk to us because of the severity of her condition. However, the community health officer says she was very appreciative of the MDG's effort for this life-saving healthcare center. Madam Titi believes without this nearby healthcare center, she would have lost her life. In this healthcare center, the people of Yenche get the very good treatment given to many of Nigerian citizens at various general hospitals. After a thorough examination of Madam Titi, the community healthcare officer administered the first aid treatment on the patient.
Before a patient should be admitted, for example, this one now, she was brought to the clinic with complaint of passing wateries to vomiting. So on consultation, after the consultation, observation. So when I observed her, she was dehydrated, weak, and that is why I admitted her. Now she's on treatment. Firstly, I drip her with normal saline, then injection of antibiotics being given to her with tablets.
In FCT, we have the project composition or complement. We have the health complements and we have the youth empowerment. As I said earlier, I am the task manager for health. In health, we are talking about achieving goals 4, 5, and 6 of the MDGs. And we're in Yenche to see one of the activities or the implementation of the Conditional Grant Scheme.
On our arrival at the Yenche Community Healthcare Center, Madam Titi was the only patient on admission at the hospital. However, many had visited and had been treated. Construction of the primary healthcare center is part of the Conditional Grant Scheme initiative to better the lives of the people. The center also has a solar refrigerator where vaccines are stored for immunization of infants and children in the community. Members of the community appreciate the hard work of the MDG's office. However, they still expect more positive things that will better their lives.
When I was transferred to this area around 2007, in fact, we have a certain clinic behind this one, the small one, and I complained bitterly as the work focal person of the area, because if it rains, you cannot able to stay in the clinic, and even the patients, when they come, they will see that they cannot even enter. We sometimes treat outside, so they go back. So sometimes they will complain not coming to this area. They will divert to a private clinic somewhere else. So I'm very, very happy, and by seeing this, the work of the MDG, I'm even impressed, very much impressed.
Today, the joy of the people of Yenche community can never be overemphasized as they take full advantage of a well-constructed modern healthcare center. Today, the many people of Yenche community say the days of heavy flood in their clinic are gone. The days they had to battle to get rid of rainwater that floods the entire premises before attending to patients. As the people of Yenche remain very happy with this project, so is the MDG's office working hard to better the lives of the many poor people in Nigeria's rural communities.